First of all, I know the cat is out of the bag because everybody comes up to me and wants to know why I have a tie on. So they're assuming it's a pretty big announcement if I put a tie on for y'all. Good morning. I am Kevin Eltife, and I'm honored to be on the University of Texas Board of Regents. I currently serve as its chairman. I want to thank all of you for being here today for what we believe is an exciting announcement about the future of education and healthcare for our community and for our state. Once implemented, this will be a game changer for students and families in all of Northeast Texas and have a major positive impact on our economy. I want to first thank the media for taking the time to be here today. We know how busy you are, and we appreciate you being here. You will hear from UT leaders and elected officials from the podium, and then afterwards we'll be available to the press for questions. I would also like to take time to introduce our elected officials who are here today. I know firsthand how hard they work and the sacrifice they make and their families make to serve our community, and we greatly appreciate all you do for us. So I'm going to hold your applause till the end, but let me introduce who is here today. Representative Cole Hefner, Representative Matt Schaefer, Representative Jay Dean, Representative Dan Flynn, Representative Chris Patty, Representative Travis Clardy, Representative Gary Van Dever, Councilman Don Warren, Councilwoman Linda Sellers, Councilmember Bob Westbrook, Councilman Broderick McGee, Mayor Martin Hines, Mayor Jeff Daughtry, Mayor of Lindale, Commissioner Joanne Hampton, Judge Nathaniel Moran, TISD Board Member Andy Bergfield, TJC Board Member Lonnie Uzell, Constable Bobby Garman. I think I've got them all, I hope. If I've missed someone, raise your hand, because we definitely want to thank you for being here. Let's give them a round of applause for all they do for us. I also want to recognize some other elected officials' offices who could not be here, but they sent representatives. We have Jonna Fitzgerald from Representative Gomert's office, Kathy Comer and Reese DeWoody from Senator Cornyn's office. I saw Jason Wright from Senator Cruz's office, Dr. Marty Crawford, our superintendent from the Tyler Independent School District, Ed Broussard, the city manager for the city of Tyler. I believe the president of TJC, Dr. Juan Mejia, is here. June Cheatham, chairperson of the Tyler Area Chamber of Commerce, and Tom Mullins, the president of the Tyler Economic Development Council. We also have Senator Hughes and Senator Nichols could not be here. They've sent letters of support, and Courtney Smith and Michelle Slayton from their offices are here. Let's give them all a round of applause. I also want to introduce and thank our University of Texas system staff, which I have the pleasure of working with, who are here today and have been a tremendous help with advancing our two institutions in Tyler. Chancellor J.B. Milliken is with us today. Executive Vice Chancellor John Zerwas, Vice Chancellor for Government Relations Stacy Napier, Vice Chancellor for External Affairs Rhonda Safety, and Associate Vice Chancellor Sean Griffin. Let's give them a round of applause, and thank you for all you do for us. All of you are here today, have played a role in advancing our two institutions of Texas, our two University of Texas institutions here in Tyler. You've all brought us to this point today. We are so blessed in this community to have so many people who give of their time and treasure to better our community. So many have gone before us, and we all stand on their shoulders as we do our part to continue to provide opportunities for future generations. We are grateful to the Board of Regents for providing leadership and seeing the great potential and opportunities available for us in Northeast Texas. Before we move forward, allow me to offer a little context of how we arrived here today. In 2018, the Board of Regents approved our partnership with Ardent Health Services and the East Texas Medical Health System to create a newly formed regional network of hospitals, clinics, rehab centers, freestanding emergency centers, and urgent care facilities throughout East Texas, now called UT Health East Texas. In November of 2019, the board voted unanimously to allocate $95 million from the Permanent University Fund to UT Health Science Center at Tyler and UT Tyler to fund construction of two new facilities to accelerate high-quality health care and education in East Texas. This allocation represented the largest single appropriation from the Permanent University Fund awarded to Tyler at one time. $35 million for an advanced nursing and sciences complex at UT Tyler, and $60 million for a graduate medical education program at the University of Texas Health Center at Tyler. 1 month later, the Board of Regents authorized the integration of talent and resources at UT Tyler and UT Health Science Center to come together and form one institution. With an eye on the students, this alignment will benefit students from both institutions with a more robust educational environment. As Dr. Calhoun said at the time, this new alignment builds upon many strong partnerships that already exist between the Health Science Center and UT Tyler. This alignment represents the Board of Regents' commitment to build the best opportunities for students and faculty and patients in East Texas. Dr. Tidwell stated, "One unified presence in East Texas will make us a more impactful and capable asset while providing greater clarity of UT's important mission and identity in this region." After receiving Board of Regents approval for the new alignment, I appointed a community advisory committee to work with both presidents as we move forward. Former Mayor Barbara Bass will chair the committee, along with committee members Reverend Arinthia Mason, Bob Garrett, Elena Lycia, Dr. Paul Detweiler, Mayor Martin Hines, Tom Mullins, Gaylord Dewey, and Judge Bill Stout. And we want to thank them for their willingness to serve on this important advisory committee. All of these actions by the Board of Regents has set the stage for today's announcement. In order to maximize UT's presence in Tyler, to serve all of East Texas, to enhance higher education opportunities for students and patient care, the one missing link in this integration is a medical school. And today, I'm officially announcing that we will seek approval from the Board of Regents at our February 26th meeting to establish a medical school here in Tyler, Texas. I think they're excited. It is. It's very exciting. And I can't help but think, and I don't want to start naming names, but I can't help but think of all the people that have gone before us to make this happen today. I mean, I just, if I start, it'll never end. But I think of, we used to call them the graybeards at the chamber meeting. They all sat in the back, and it was the older gentlemen and women that laid the foundation for all of this. I mean, we're lucky that we're here today, but it's because of people before us. So upon approval by the board, we will work with all appropriate licensing and accrediting agencies and our state leaders to create a medical school. It will take energy, diligence, and a commitment of resources from both the public and private sector, but I believe the need is here and the time is now. Think of the impact this will have on students, families, and patient care in our region. We have 3 great hospital systems right here in Tyler: UT Health East Texas, Christus Mother Francis, and Baylor Scott and White. Having more healthcare professionals in our area will have a positive impact on all our hospitals, not to mention the huge economic impact it will have on our entire region. This community has always amazed me with its drive and determination, and over the years we have accomplished incredible things. And I know we are all up to the task of working together to establish a medical school right here in East Texas. At this time, I'd like to call up a friend and someone who has been doing an outstanding job as our chancellor. I became chair a few months after he became chancellor, and we've built a great working relationship. And I want to tell you something. We have 14 institutions in the UT system, and the chancellor cares deeply about all 14. But I'm also here to tell you that he has spent countless trips back and forth to East Texas, and he is a big reason we're here and this is happening today. So please welcome Chancellor J.B. Milliken.
Thank you. Thanks, Chairman Eltife. I can say to this group, and you all know this already because you've known Kevin for a long time, but leadership makes a difference. And having Kevin Eltife as chairman of the Board of Regents is making a difference for the state of Texas. So this is a great day and a lot to be very positive about. I'm going to be the skunk at the picnic just for a moment and say that we have a big challenge in Texas. first of all, health outcomes in the state are not what we would want them to be. And part of the reason for that is the number of healthcare professionals, and particularly doctors in Texas. We rank 45th per capita in the nation in terms of doctors per capita. And if that were the end of the story, that would be enough, I think, to justify developing a new medical school in Tyler. But it's not the end. We're the fastest growing place in the country. The state demographer says we may double in 30 years. We are going to need more healthcare professionals in Texas, and particularly in East Texas, to provide the opportunities that our people need. So one of the challenges I've seen in every state I've worked in is the difficulty in bringing highly trained professionals outside of the largest urban areas. And that's true in Texas as it is elsewhere in the country. One of the key strategies to overcoming that is where we provide an education, offering opportunity to people who grow up in the region, offering residencies in the region so that healthcare professionals and doctors in particular will stay and work and live in East Texas. So this is an important, perhaps the most important strategy to improving healthcare in this part of the state. Now, the work that we're doing now that Chairman Eltife alluded to with Presidents Tidwell and Calhoun to combine UT Tyler and UT Health Science Center Tyler into one integrated, stronger institution will provide the foundation for this new school. Students in the region will be able to pursue from high school on their education, their medical degree, and their residency, and then practice in East Texas. And the University of Texas system is uniquely qualified to oversee the development of this new medical program. We have 6 medical schools today, and we have a deep bench of talent to draw on. And we're not starting from scratch in Tyler by any stretch. We have a successful health science center here already with strong clinical operation. In fact, UT Health Science Center Tyler is the only non-specialized health-related institution in our system without a medical school. This is a natural progression, a logical extension of the resources and strengths that exist in Tyler today, and it's the best strategy to address the challenges of healthcare and growth in Texas. I could not be more excited about the prospects for health education, training, practice, and ultimately outcomes in East Texas, and I am committed to working with Chairman Eltife and the rest of our team and all of you here to make sure that this happens. Thank you very much.
Thank you, Chancellor, and thank you and all of system staff for being here today. The next person I want to introduce really doesn't need an introduction, but let me just tell you, Dr. Calhoun has been the driving force behind all of this for 20 years. He has actually driven me crazy for 20 years with his determination and tenacity to build up the Health Science Center and move this whole thing forward for the last 20 years. Together, we walked the halls of the Capitol begging and groveling for money for many years. And he was so instrumental in the ardent partnership that we created and that we fly the UT Health East Texas banner that we fly now. And I can tell you, over the last 20 years, I can't tell you how many times we discussed the possibility of a merger and a medical school in Tyler. And so I want to welcome to the podium our great president of the UT Health Science Center, Dr. Kirk Calhoun.
Well, I thought I had my emotions in check until now, and so I'll try my best to stick to the script. But I do want to say that Chairman Eltife has been fantastic, and I do remember walking the halls of the legislature. I remember chasing him into the men's room, begging for resources for our campus and for our region with respect to health care. And there was not a legislator at the Capitol who was more respected by high and low, Republican, Democrat, liberal, conservative, House, or Senate, there was not one that was more respected than Kevin Eltife, and he's carried that over as chairman of the Board of Regents. The last few years have been exciting for the Health Science Center. We opened our new Cancer Center, started and built our School of Community and Rural Health, created the UT Health East Texas Health System. We've created new graduate medical education programs, both in Longview and here in Tyler, and that's about to explode with more internal medicine residents and surgery residents being trained right here in our own community. And with Dr. Tidwell, we started early work to align our two institutions in Tyler. And now, this amazing announcement about our new medical school, and when I say our medical school, I don't mean the Health Science Center Tyler. I mean this community, our medical school. The UT System Board of Regents have taken the action to align our two East Texas institutions, and I believe three important goals are paramount. First, to unify the UT presence and brand across our region. Second, to better utilize our resources to serve all Texans. And lastly, to create a seamless environment for students and faculty to interact and work together. This new and what you'll come to believe as a quite unique medical school is an early example of the wisdom of the Regent's decision. I thank Chancellor Milligan, of course, Chairman Eltife, the entire UT Board of Regents for their efforts to improve education and health care. I thank our UT faculty from around East Texas and beyond. I thank all of our team members and friends, many of whom are in the audience today. Of course, I thank Jeanette for putting up with me and the long hours and the work that we've been putting into this. But most importantly, I want to thank our elected leadership from around the state, and especially those members of our East Texas State Delegation. I want you all to stand and take our applause, because without their help and support, we wouldn't be here. The delegation's guidance and their support of higher education and health care has been and remains significant. Without the efforts of our legislative leadership, we absolutely would not be here today. Thank all of you for joining us on this historic day in East Texas. And God bless Texas, and God bless East Texas. Thank you.
Thank you, President Tidwell. President Calhoun, excuse me. I'm going to now introduce Mike Tidwell. President Tidwell, as you know, is president of the University of Texas at Tyler. He's going to come up and speak next. I just want to tell you, he has done an outstanding job the last few years moving University of Texas at Tyler forward. Great enrollment, great new facilities, and it's an honor and privilege and pleasure to work with you. Dr. Tidwell, please come forward.
Thank you, Chairman. When I arrived, had a chance to spend time in the community and ask folks, many of you, who are the individuals that, in addition to yourselves, that I should take time to meet. And Chairman Eltife's name continued to come up. But it wasn't until he was nominated to become chairman, actually a member of the Board of Regents, and then ultimately chairman, that we had an opportunity to meet. And it has really been a pleasure working with him since he has both taken the position as a Board of Regents member and then ultimately as chair. So good morning again. As noted by the chairman, my name is Mike Tidwell. I'm president of UT Tyler. As all of the other speakers have noted, this morning is a very auspicious occasion, an occasion that signifies the unique past and the extraordinary future of higher education right here in East Texas. An occasion that we will all remember because today is the day when higher education across East Texas moves from the statewide conversation to the national stage. Indeed, today is a great day. Now, I make these statements because today's announcement indicates a major step forward in the delivery of medical education and clinical care across our region. Now, while Tyler is home to the top nursing program in the state of Texas and the only school of pharmacy in all of East Texas, when it comes to doctors, we have to rely on other regions and other universities for their assistance. Tyler has one of the largest concentrations of medical professionals per capita in the state of Texas. But again, we depend on other regions and other universities to supply our physicians. Now, partnering with other universities and other regions of the nation and of the state, it's perfectly okay, and it's certainly the kind of thing that we will continue to do as we go forward. But through the vision and the hard work of Chairman Eltife and the Board of Regents, today again is the day where we will take the additional step forward to begin to grow our own. One of the things I love most about East Texas is that we are independent and self-sufficient. So this is a major move forward in the promotion of those values of being independent and self-sufficient. It doesn't mean that you don't rely on others and partner with others. We will continue to do that. But it does mean that we need to begin to grow our own. For example, right now at UT Tyler, we operate a new pre-med academy. Now, the pre-med academy enrolls college students who ultimately want to develop the skill sets necessary to go on to medical school. We currently enroll over 100 pre-med students, but when they graduate, they have to leave East Texas and go elsewhere to find a medical school. Most of them never return to East Texas until today. Today, again, is that day where we will begin to grow our own. Today is a day where what I like to call a pivot point here in East Texas, where a student that might be studying at Lee or John Tyler or even Longview High School that might want to make the decision to go on to study pre-med, to start medical school after that, do their clerkship soon after they do their first couple of years of medical school, and even go on to do their residency and then into their practice of medicine can stay right here in East Texas for all of it. So today's announcement will revolutionize higher education, medical education, and the delivery of medical care right here in East Texas and for East Texas. Again, thank you all for being here today. We really do appreciate your help and your support.
Thank you, President Tidwell. We're incredibly fortunate to have Dr. Calhoun and Dr. Tidwell at our two institutions. At this time, I'd like to call up our incredible two elected officials that run our city and county and do a phenomenal job, Mayor Martin Hines and Judge Nathaniel Moran, for a few words.
On behalf of the City of Tyler, thank the UT system and the legislature to work on this item. We have 25,000 medical-related jobs in this community today. These are people from all over the East Texas region that come to Tyler to service the patient needs. This educational enhancement will allow us to better care for our people. And that's what it's all about, is making sure that we have good patient outcomes with good education quality for our residents. So thank you for this opportunity, and I truly believe Tyler is in the right place at the right time to service the needs of all of East Texas. Thank you.
Good afternoon. My name is Nathaniel Moran. As the county judge here, I want to remind you that in the life of every community, just as it is in every sporting event, there are in fact defining moments. Moments of greatness, moments of destiny, and game-changing moments, as the chairman mentioned earlier. Whether or not it's a fourth down scramble with 19 seconds to go, 8 yards to get to the goal line to win a national championship game, that's a defining moment in a sporting event. Or if it's something like we're seeing today, this is a defining moment for the community here in Tyler and East Texas. This is a moment of indelibility that's going to have an eternal impact on this community and those members here. But these moments just don't come around without a lot of hard work, a lot of preparation, a lot of years of sweat and tears. That's what it takes to get to this point today. It also takes the right people at the right time and the collective community gathering around to say, we are going to make this succeed. We are not going to let this fail. So today, Dr. Calhoun, Chairman Eltife, Chancellor Milliken, from Smith County to you all, I offer you congratulations on this great event, on this great day to announce what's to come here in East Texas, but I also offer to you our commitment to be great and strong and faithful partners to you as you move forward. That's what it's going to take, the community coming around to make sure that what has been dreamed today will become a reality for the future. We believe it and we will achieve it. Congratulations.
At this time, I'd like to call up Representative Schaefer and all of the state representatives that are here today to come up and make brief remarks. Travis, Clardy, brief. But I want to point something. Y'all come on up if you'd like to. I just want to point something out. We are extremely honored to have 7 state representatives here. Their time is so important to them. They have to cover their entire districts, and I'm just telling you, we appreciate you being here today. Representative Schaefer.
Thank you. I call him Senator Eltife. He goes by a lot of names, but thank you all. It really is an honor to be here and to be part of this. This will require legislative action, and this will be a team effort from those you see here on the platform, and it will be a united political effort. Senator Hughes will be involved in that, and we're going to get it done. And why do we have to get it done? When you think about that mom that just hears about a tough diagnosis for their child, when you think about workers out at Delic, or a custodian at a small public school, or a guy driving a logging truck in East Texas, you want to have the same high standards of health care that people do in Dallas and Houston and other places. And the standards of health care in Tyler and East Texas have been rising, but we can take it to another level. This is the right thing to do for the state. We're going to grow. This is the right thing for 40 years from now. And so when I look at taking your hard-earned tax dollars and applying them to an expensive effort like this, we say, what's it going to do? Is it the right thing for government to do? Is it the conservative thing to do? Well, we do have a constitutional role to teach people and to educate people. But we have a responsibility here in East Texas to raise the standard of health care, and bringing all these medical students here and all the faculty and everything that does to raise the quality of health care for the entire region is so very important. And let me go back to a moment in our history when we created the pharmacy school out there, and Brookshire's Grocery Company was involved in that. They said, when we do this, we believe we'll be able to keep more students here to serve fellow East Texans. And I said, I hope that's the case. And we did it. And you know, I've had the privilege of sitting in a room full of pharmacy school students here last year. And I went around the room and I said, where are you from? And where are you going to stay? Where are you going? And I'm telling you, so many of them said that they're going to stay right here in East Texas when they're done getting their pharmacy training. Folks, that's what this is all about. And I'm so thankful to be a part of this, and I look forward to working with my colleagues in the UT system to get this done.
You know, in van, a hat or tie is optional, Mr. Chairman. Just wanted you to know that. This is a very personal thing for me. Kirk Calhoun, you are a champion to me. I wouldn't be here today without your encouragement, and I will forever remember it and thank you very much. But this system is great. I've been a champion of the Board of Regents all my career at the University of Texas, working with you, and I am thrilled to death in East Texas. We're going to continue to grow. God bless you.
Thank you. And Matt, I continue to call him Mayor Eltife because we served Mayor Longview and Tyler at the same time. But listen, this is all about regionalism. You know, Judge Stout wasn't able to be here today. He's down in Austin taking care of some things. But, you know, this is about regionalism and how we all work together to provide for East Texas. You know, you can tell that I'm not from East Texas by my accent, but let me tell you something. With the inclusion of this facility, I continue to tell people we have all of the benefits of great medical practices for any illness that we might have. We can stay right here at home, and this will just continue to help us to do that. Thank you. God bless y'all. Congratulations.
Well, good morning. It is a great day. I call Kevin several things. Some of them I can't say in front of you. No, most importantly, I call him friend, and he's been a tremendous friend to me, and I know many of the members standing behind me, and had the pleasure to serve alongside him when he was still in the Senate, and I agree wholeheartedly. One of the most respected members ever of the legislature. We're so thankful for that. I also would like to point out this morning that I am an Aggie, and I chose this tie just for you guys today. You're welcome. But to echo what Senator Eltife said earlier about a game changer, you know, we know as members of this community and certainly as legislators the tremendous challenge we have with health care, particularly rural health care, and how we deliver that health care in a way that's accessible and affordable. And a lot of that is driven by what we're here to accomplish today in creating a medical school, because we spend lots of money trying to incentivize folks to come and stay in East Texas, and often we're not successful in doing that. Even if we are able to get them here, lots of times they then leave. And so I love the idea of growing our own. I've long said that that is the solution to our problem. For folks that were born and raised in the East Texas area, why would they want to go anywhere else? And to provide that opportunity now for them to practice and serve the people of East Texas, that is a game changer. Thank you for all that you do. There are many people in this room who made this possible today, and I'm just glad to be here with you. God bless you.
Well, thank you. Thank you for the invitation to be here. It is a great day for East Texas. I represent the Northeast Texas portion, and Dr. Calhoun, it's been such an honor to work with you. I've had the honor of serving on Article 3 of Appropriations for the last 3 sessions, and in that role, we've spent a lot of time discussing the needs of East Texas. And when Dr. Calhoun says this is for the community, I know the community to him is a very large area, and it encompasses Texarkana as well. And it is a large community, and this is a great day, not just for Tyler. It is absolutely a wonderful day for Tyler, but it's not just for Tyler. It is for all of East Texas, and we look forward to working with you, look forward to being a partner as you go forward. So congratulations. God bless.
Well, thank y'all. I'm Cole Hefner, and I live up in Mount Pleasant, but I represent an area that comes all the way down and got part of Smith County and a little bit of the city. And just thank y'all for being here. Thank y'all for the work that's gone into this. Dr. Calhoun, Dr. Tidwell. I know that this is not something that just happened yesterday, and I'm excited about it. Y'all know the challenges we face in healthcare in our rural areas. It's just a challenge. The urban areas are growing, and so this is going to be a huge step to help us advance healthcare in our area. My family was just recently a recipient of the Great Care at UT Health here, and so we have great doctors, great facilities here, and I was talking to Mr. Chisholm earlier about the great care that we just received, and so this is only going to make it better going forward. And you have a united East Texas delegation here. We're committed to working together for our region. You know, I was thinking about it, Gary. So Gary Van Dever has the along the Red River, and I think Chris Patty comes kind of down the Louisiana side. So, we talk a lot about the border and things in the legislature, but they're kind of our first line of defense on the border with Oklahoma, the border with Louisiana. So, yeah. And I got a Louisianan behind me. I got to be careful.
Go Tiger.
Sometimes we have to have his remarks reduced to writing and placed in the journal. We have to get them interpreted into English first. But anyway, thank y'all for being here. It's an honor to be a small part of this, and we look forward to doing our part to move it forward. Thank y'all.
I'm Travis Clardy. Those of you in the back might want to just take some seats on the floor. This will take just a little while, but it is an honor to be here. I represent Cherokee, Rusk, and Nacogdoches counties. But I tell people all the time, Matt is the in-house representative for the city of Tyler and for Smith County, and I'm the out-house representative for Smith County and Tyler because I love this town so much that I married one of your daughters. And my wife is here in Tyler, grew up here, Tyler Junior College, and their family's here. We have a place on Lake Tyler. Love this community and have been very proud to work with Senator Eltife back in the day and with Representative Schaefer to push through some of these things in the medical community with the dental hygiene program, with the expansion of the nursing program, with the pharmacy program we've discussed. This is a natural and logical extension of that work and to see the medical community continue to grow. Sometimes we go to Texas into Austin and we have to preach what I call the gospel of East Texas. And that is to remind people that this is a beautiful and wonderful place and that people here actually have socks and wear them, that these are educated and smart people, some of the folks behind me notwithstanding. But in any event, this is a special place in our hearts, and it is a great place for us to be because, I tell folks, inside every American there's a Texan trying to get out. And in the cities, there are people that are trapped in the concrete jungles. And they have to be there because that's where the jobs are. For too long, we've had our kids, our money, our power, our energy go from the rural areas and into the cities. And it's time that we stop that unsustainable trend and bring folks back. It's time, Muhammad's gone to the mountain, it's now to the mountain to go to Muhammad. It's that sort of thing. And it's time for this to really step forward and lead the way for East Texas, for rural Texas, to say this is a place you can live and raise your families and have an extraordinarily high quality life and not be stuck in traffic for hours on end. So this is a great day. I could go on forever, literally, but I will not. It's not a filibuster, I promise you. So with that, but congratulations, Tyler, Smith County, University of Texas, all the folks here. This is a team effort now. It's going to be a team effort in the future, and I'm glad to play some small part in it. Congratulations.
Thank all of them for being here. We appreciate you very much. Because to accomplish this, we will have to have them fighting for us in the House, and we know they will, and we appreciate that. The last speaker, saved the best for last because he's going to tell you what an impact this is going to have on the economy, is we all know President of the Tyler Economic Development Council, Tom Mullins. I've worked with Tom for 30 years, and for 30 years, Tom Mullins has preached to me that health care is the future to this economy. And he has gone on about how we're going to become a health care destination. He has told me that for 30 years, and his prophecy has come true. Tom, thank you for all you've done for us. Tom Mullins.
Thank you, Chairman. And thank the UT system for this monumental investment in the future of Tyler and Smith County, but as many of the speakers have said, all of East Texas and even beyond East Texas. If you look at the U.S. from border to border, and even globally, you'll see a consistent pattern. Wherever you find strong, knowledge-based economies, you will find a major higher education presence. It just happens everywhere you look. Tyler has worked hard to be a medical and educational destination with Texas College, Tyler Junior College, Tyler, University of Texas at Tyler, UT Health Science Center. They combined now have 23,000 full-time students. In addition, as the mayor said, we have 25,000 direct medical jobs and another 10,000 indirect jobs that support the direct jobs. The economic impact of today's announcement will, according to Dr. Ray Perriman, the Perriman Group, have a cumulative impact over 10 years of $2.8 billion and will create close to 30,000 direct, indirect, and induced jobs for our region. In addition, after the 10-year period, every year, another $1.9 billion of income coming into this region's economy. Annually, every year. After hearing about the UT system plan, the chairman of the Economic Development Council said, and you've heard this from several speakers this morning, this is a game changer and will impact Tyler and East Texas for generations to come. Congratulations.
Thank you, Tom, and thank you for the work you've done for us for the last 30 years. We appreciate you. We have much work to do, and we will need all of you to help us move this forward for the good of the people of Tyler and the entire region. We cannot thank all of you enough for being here today. It's a great day. It happened because a lot of the people that have gone before us and because all of you in this room. We will get this done. Thank you, and God bless you.